morning, everyone. My name is Angela Freeman. I am Project Manager of Building Healthy Urban Communities at Rush University Medical Center. So today I am going to discuss some of the strategies that we've been using to address and potentially close the educational opportunity gap, specifically looking at how we have partnered with our community college to meet the needs of a changing public health workforce. So to begin, I am just really going to set the stage before I really dive into some of the work that we've been doing. So we're going to go back to the beginning and discuss some of the issues that are facing Chicago that drove the work that we are doing currently. So to begin, we did a needs assessment of our community, and we found that these issues really could be grouped into four main areas. So there's health disparities, there's disjointed care for the poor, there's lack of access to meaningful education, and then of course lack of access to job opportunities. So looking more at that first area, healthcare disparities, our first snapshot of Chicago looked at the disparities affecting communities and populations within the city. So when you really look at the data, it really paints a stark and complex picture of health and wellness outcomes in many Chicago communities, varied by race, income, and ethnicity. So for example, a Black woman in Chicago is more than twice as likely to die of breast cancer than a white woman. Blacks represent 1/3 of Chicago's population, but they account for 60% of HIV diagnoses. 23% of Black Chicago high school students and 22% of Hispanic Latino students are overweight, compared to 12% of white students. And then 23% of Humboldt Park residents, which is a community area on the west side of Chicago, the residents have type 2 diabetes, while 18% are at risk. So moving towards the disjointed care. So of course, health care disparities pose ongoing challenges to Chicago, but further in the problem is disjointed care for the poor. So that lack of continuity, it's been associated with higher costs and lower quality of health care. So Medicaid guarantees access to insurance, but not necessarily to care. Over-reliance on emergency rooms for primary care, and then no formalized connections between community clinics and then specialty care providers. So next, we're going to look at lack of access to meaningful education. This is really sort of the area that the rest of the topical talk will focus on. So accessibility issues as they relate to education, lack of access to meaningful education prevents Chicago's most vulnerable populations, the opportunity to escape the cycle of extreme poverty. Further heightening the problem of educational attainment, are some of the challenges navigated by Chicago Public Schools, or CPS, over the years. So that means budget shortfalls, safety concerns, ongoing cuts to staff and programs left many CPS schools unable to provide a high quality education, meaning that even students that have the desire to go on to pursue higher education, they're typically unprepared for its rigors. And of course, this leads to residual effects for educational outcomes at the post-secondary level and beyond. So at the time, as we were putting this work together, so around 2012, 2013, city colleges had a graduation rate of about 12%. In Chicago, 17% of Blacks and 12% of Hispanic Latinos have a college education, compared to 55% of whites. And then some stats related to job openings and jobs remaining open due to lack of qualified candidates. And so the last area looks at lack of job opportunities. So a report released by the Brookings Institute shows that the nation's largest metros, of the nation's largest metros, Chicago has the greatest racial disparity in young adult employment rates. So 21.4% of Blacks and 13.3% of Hispanic Latinos are employed, compared to 7.8% of whites. In Chicago, spatial, social, and economic isolation contribute to high Black unemployment rates. The report also said Black young adults in the Chicago area are 7 times more likely than white young adults to not be working or going to school. And so this group is known as our disconnected youth. So such young people are feared to be at an increased risk for a host of negative outcomes, including long spells of unemployment, poverty, criminal behavior, substance abuse, and incarceration. So, armed with all this data and information, what did we want to do? How did we want to affect change, work towards health equity and improve the quality of life overall? So these 4 puzzle pieces represent the areas that we want to target and how they're interrelated to one another. So better training. We can train people better to lead. We can train people better to lead to better opportunities for jobs. And then those jobs would then lead to better care models, with all of this being done in a way where we were able to measure results and demonstrate changes in outcomes. But achieving these enhancements required several significant investments. So supporting new models of care with the ability to dramatically impact community health included the following key activities. So that meant developing and delivering novel, continuing medical, nursing, and interprofessional educational programs, to prepare existing healthcare providers to deliver high-quality care through a partnership with the Medical Home Network, which I'll cover a little bit more in depth shortly. It meant creating a new pipeline of allied health professionals to work in these medically underserved communities. It meant providing enhanced outreach to the west and south sides through our participation in the Medical Home Network, and also ensuring the community is well informed about new ways to access care. It also meant evaluating these new models of care delivery on healthcare quality and cost. So at Rush, our mission is to provide the very best care to our patients. So we decided significant investment in these 4 domains will push us further toward achieving this mission and transforming community health on the west and the south sides of Chicago. So it is these 4 components with 2 other key areas that comprise building healthy urban communities at Rush. So what building healthy urban communities is, it is a collaborative project between Rush University Medical Center, Malcolm X City College, which is one of the city colleges of Chicago, and the Medical Home Network. It's focused on improving health on the west and south side communities of Chicago with funding support from BMO Harris Bank. And so what our plan is, it's to improve health through education, through employment, through new models of care, deployed through these communities. And the project was launched in 2013. So this project was made possible with funding support from BMO Harris Bank. So their tremendous gift of a $5 million donation supported Rush in leading a partnership with hospitals, medical homes, and educators creating these new models of collaborative care. So the first part we're going to look at is Medical Home Network. So the Medical Home Network, or MHN, is one of our key community partners within building healthy urban communities. They're an accountable care organization, an integrated care network. They work primarily within safety net populations, so your Medicaid beneficiaries in the south and west sides of Chicago. They work to address disparities of care and access. They're governed by 12 healthcare organizations, so 3 health systems and then 9 federally qualified health centers. They use a team-based model of care that emphasizes care management at the practice level. So when you think about this patient population, they may have coverage, and they can access services, but are they really able to achieve better health outcomes at the population level? The expectation that these patients can navigate the health system, dealing with disparate providers, unassisted, is really somewhat unreasonable. So what MHN looks to do is bring in alignment. They align providers, so they're working together, they're sharing information, and they're really trying to create a comprehensive view of the patient and use care coordination to assist their patients. So their initial patient population included 170,000 plus Medicaid enrollees on the south and west sides, primarily women and children, each of whom is assigned a designated medical home within the network. A web-based electronic portal links the group's 6 participating health systems and their federally qualified health centers and private practices across their sites. So when a patient seeks care outside of his or her medical home, the primary care physician receives electronic notification in real time, resulting in a really sort of unprecedented care coordination across providers. So our next project partner is Malcolm X City College. So Malcolm X is one of the 7 city colleges of Chicago. It's a community college. They offer associate's degrees, they have certificate programs, and they have short-term training programs to prepare its approximately 5,000 students to transfer to bachelor's programs or move directly into the workforce. Its students are predominantly, African American or Hispanic, and they come primarily from high schools within Chicago public school system. So the work between Malcolm X and Rush has occurred informally for decades. But with the reinvention of Malcolm X as the health sciences hub of city colleges, combined with various efforts happening at Rush, have really allowed the organizations to add more formal structure to our relationship. So Rush has enjoyed a collaborative relationship with Malcolm X since 2008 and probably even prior. Our history of strong, respectful, and impactful cooperation has included guest lectures, equipment donations, and other collaborative projects, all aimed at enhancing the quality of education available for students at Malcolm X. So in recognition of our long-standing and mutually successful collaboration, Rush was asked to serve as Malcolm X's lead business partner in the College to Careers initiative, so making them, the clear choice for academic partnership under Building Healthy Urban Communities. And I'll dive a little bit deeper into the relationship with Malcolm X and Rush in a little bit. So in terms of building healthy urban communities, it's looking to address 6 key areas. So there's better training, there's better care teams, there's better patient outcomes, there's better data and measurement. There's our Health Disparities Fellowship, where we're looking to develop a core team of postdoctoral researchers. And underlying all of that is overall evaluation of the project. So rather than getting to the end of the grant and then determining what our evaluation process is going to be, we've been evaluating as we go along, which has allowed us to really sort of adapt our curriculum and really given us the flexibility to better work towards our goals. So that first key area, better training, that's really where our work between Rush and Malcolm X is housed. So that includes curriculum development in collaboration with Malcolm X, as well as scholarships for students looking to come from Malcolm X over to Rush to continue their education in our bachelor's level programming. So here is just an overview of some of the stakeholder goals for success. So with each partner, we wanted to identify stakeholder goals for success specific to that organization and our partnership under this work. So some relate to reducing health disparity, develop training, making sure we're aligned with the needs of the workforce, focusing on community health work, allied health professionals, and then of course making sure we include measurement and evaluation. So at this point, I'm really going to focus down on the better training area of this grant. So looking at our stakeholder goals as they relate to education and how they are realized in several cross-institutional allied health educational initiatives that we have going on. So I want us to look at both the structure of our programs, how educational pipeline programs can be positioned to increase the diversity of the allied health workforce, how we can address those educational opportunity gaps and develop health professionals focused on reducing health disparities, and the lessons learned from engaging in this type of complex partnership. So as part of the better training component, The Rush-Malcolm X partnership represents an important educational opportunity for students. So 4 major goals have been identified to integrate planning and promote the academic pathways across these institutions. So again, ensuring alignment of our curriculum, creating additional programs that will fit into the new health sciences structure, focusing on community health workers and allied health professionals, and then measuring the success of the work that we're doing. So, partnering institutions. So Malcolm X College is one of the city colleges of Chicago. It's a major provider of training for health professionals. Through working with healthcare and industry partners, Malcolm X provides students with career-oriented education in the healthcare field. So the way the city colleges of Chicago are structured is they have a sort of decentralized model. So each institution is known as what's like a center of excellence, or they have an area of specialization. So Malcolm X College is the health sciences institution within the city college network. So in January 2016, Malcolm X opened a brand new state-of-the-art School of Health Sciences, which featured a virtual hospital, and it also houses the City Colleges of Chicago School of Nursing. So Rush, on the other hand, we're a non-for-profit healthcare education and research enterprise. So it's Rush University Medical Center, there's Rush University, there's Rush Oak Park Hospital, and then Rush Health. So Rush University Medical Center is a 664-bed tertiary care academic medical center that includes facilities for both adult and children. Rush University is a private university and the academic arm of Rush University Medical Center. It's home to one of the first medical colleges in the Midwest and includes one of the nation's top-ranked nursing colleges. So both of these institutions are located within the Illinois Medical District. So that's a 365, 24/7 environment that contains acres of medical research facilities, labs, biotech business incubator, 4 major hospitals, 2 medical universities, and more than 40 healthcare-related facilities. So we really try to capitalize on our positioning both on the west side of Chicago as well as within the Illinois Medical District to the benefit of our students and allied health professions. All right, so ultimately what we are working to address are disparities in access to quality education, training, and the resources needed to be academically and professionally successful. So we want to open up and expand the pathways between Rush and Malcolm X and have that serve as one of our sort of overarching goals of this partnership. So what has worked? In terms of what has worked, it has been the focus on engagement and advancement of learners at various points of the education continuum. So here we highlight 4 education initiatives either piloted or enhanced under Building Healthy Urban Communities Better Training Key Area. So we have the Malcolm X Rush clinical rotations, where Malcolm X students shadow clinicians at Rush as a part of their academic program at Malcolm X. We have the Community Health Worker Basic Certificate Program, which is housed at Malcolm X, designed to focus on preparing students to work in a either primary or preventive healthcare environment and give them the skills needed for community health work. We have the Rush Summer Enrichment Program, so this is geared towards students who are in the biology program at Malcolm X. It's supposed to provide them with exposure to various careers within the allied health professions. And then finally, we have our Bachelor of Science and Health Science program. So this is, creating that bridge from an associate's to a bachelor's level degree at Rush to hopefully graduate level or professional education and beyond. In addition, we also have 2 BMO Harris Bank Health Disparities Fellows that are charged with either program planning or evaluation of the work that's been happening between Rush and Malcolm X. And then we also have seen 3 of the Malcolm X faculty members completing, their doctors of nursing practice in the DNP program at Rush. So again, really looking at ways to engage those learners at various points of their educational careers. So now I'm going to do a more in-depth look at all of the programs that we have going on. So one of the focal points of the work between Rush and Malcolm X is the Bachelor of Science and Health Science program. So the BSHS degree program is supposed to prepare students for entry-level careers in healthcare or graduate level studies, with students completing either it's going to be a medical science-based or a community wellness-based curriculum. So the thing about this program stream, it really was seen as a necessary addition to the curriculum offerings that we have at Rush. So Rush University, for the most part, they really are structured towards graduate level education. So, we have the medical college. We don't have an in-house BSN program. We start credentialing at the master's level for nursing programs. We have the graduate college, which again really is focused on doctoral training. Within the College of Health Science, we had 2 bachelor's level programs in vascular ultrasound and imaging science, but we didn't really have like a general health science degree. So students who were starting at Malcolm X and looking to complete their education at Rush, there really were limited offerings in terms of pathways into Rush. So we felt that the bachelor's level credential was seen as a potential barrier to students, looking to start at Malcolm X or any 2-year local institution and then complete at Rush. So the BSHS program was introduced as a way to bridge that gap to graduate level education. So as you can see, we've had about 24 students matriculate into Rush's Bachelor's of Science and Health Science program over the past 5 academic years. Of that 24, we've had about 18 of those students graduate. Of those 18, 6 of those students have matriculated into graduate or professional programs. Of those 6, we've seen 3 of those students matriculate into our GEM program at Rush, which is our General Entry Master's for Nursing. We've actually had 1 student complete that. And I think that, paints a really powerful picture. Like students, they started at Malcolm X, they got their associates, they came to Rush, they did another 2 years, they got a bachelor's, then they matriculated into our GEM program, another 2 years, now they're master's prepared nurses. And one of the students who just finished her GEM, she's been talking about potentially coming back for a DNP, a doctor's in nursing practice. So we're really, really excited about the work that's been happening around the bachelor's level program. And also, I just want to highlight that, $700,000 of scholarship dollars have been raised for students in the BSHS program. So Rush is a private university, and we understand that financial considerations can also be a barrier to advanced education for some students. So we really want to make sure, to put all of our efforts around making sure students have access to assistance and that finances wouldn't be an additional barrier to them continuing. So next I'm going to talk about the Summer Enrichment Program. So the Summer Enrichment Program, it's an 8-week independent course that is co-directed by faculty in the College of Health Sciences at Rush and then faculty at Malcolm X for Malcolm X students in the biology department. So one of the main purposes of this program is we notice that when we hear students talk about, educational attainment or their career track or where they see themselves going in terms of careers in the health professions. We hear doctor, we hear nurse, sometimes we may hear physician assistant, but we don't really hear students say, oh, I want to go into imaging or I want to do vascular ultrasound. So with this program, what we were looking to do is to really give students a more holistic 360-degree view of all of the professions within the health sciences. So the way the program is structured, it's almost like a rotation of rotation. The students are brought over to Rush. We give them an orientation. We have representatives from all of the programs within our College of Health Science come and talk about their programs. And then each week they do a rotation through that department. And then the program culminates with the students reporting out on what they learned over the summer and how this has sort of impacted their decision making in terms of where they're going to go next. In terms of the effect that we've been able to measure, we see that the effect of the Summer Enrichment Program has really had an impact on students in terms of their perspectives on allied health professions. So a 69-item survey instrument is given to the students with attitudinal, frequency, and relative quantity of response options to be completed on the first and the last day of the program. And so we're really looking to assess their attitudes concerning allied health professions, characteristics, duties, and trainings. And so this really provides us with the confirmation that this program is providing students with, realistic perceptions of allied health professional roles and responsibilities. And so currently we've done 3 cohorts of this, with our 4th cohort happening this coming summer. So we've had 14 students completing the program, 71% of them matriculating into higher educational programs. I know that 14 seems like a really small number. We can usually accommodate about up to 5 students per summer, and the only reason for that is because of space constraints within our clinical rotating areas.
Are these are Malcolm X students, or are these high school students?
These are students at Malcolm X. So these are students at Malcolm X in the biology program. I believe these are students that are close to completion of their associates. So like the summer before they're anticipated to graduate, that's usually when we're catching these students. So next I'm going to talk about our community health worker program that was launched under this grant. So, community health worker is one of those emerging professions which is, designed to directly impact health disparities. So the community health worker program is housed at Malcolm X, and it's a program that's designed to focus on the competencies universally required for primary and preventative health care. So this curriculum is geared towards students who are interested in going into community health work, or they're interested in going to like a nursing program or any other allied health profession. So the reason why I want to highlight the community health worker program is because this program really demonstrates some of the challenges that we've encountered over the course of this grant. So the CHW program was the focus area for one of the fellows of our first cohort of Health Disparities Fellows. So he was tasked with program development, pilot launch. So the program was launched back in the fall of 2014. And when it was launched back in 2014, it was credentialing at 3 levels. So you could go and get a basic certificate, which is a 1-semester curriculum. You could get an advanced certificate, which is a year if you go full-time. And then there was an associate's, which is 2 years if you do full-time. So after assessment of the first cohort, as well as demands of the marketplace, the program was paused for a redesign. So the advanced and the associates really just wasn't setting students up for a swift transition back into the marketplace. So what we did is we redesigned the CHW program approach, and we restructured it to be a basic certificate. And not only that, but the newly redesigned CHW program had some other aspects as well. So there's an advisory board governance, guiding program evolution. There's formalized curriculum that focuses on the competencies. There's also a field practicum that's embedded within the curriculum that provides students the opportunity to receive the curriculum and the hands-on learning experience practice simultaneously. And then finally, there's the alignment with Rush as a key industry partner. And so this 1-semester curriculum facilitates swift entry into the workforce or advancement to the next point on the education continuum. So next are our clinical rotations. So Rush has always been available to provide clinical rotation support to Malcolm X students. So this isn't something that was created or developed under a BHUC, but what happened is we provided a mechanism for tracking, coordination, and communication between Malcolm X and Rush faculty. Because before we sort of stepped in and built out tracking, it was really handled on a department-by-department basis. There wasn't any sort of standardized way for faculty at Malcolm X to reach out to faculty at Rush. So with our assistants, we really sort of standardized the communication pathways between the 2 institutions. As you can see, we coordinate clinical rotations for Malcolm X programs across 10 different academic areas. So I included this. This technically doesn't fall under the better training area of BHUC. So this is our better care team. So this is our continuing education piece. I included this because I wanted to just briefly touch on this area, since it's technically separate from better training, but it further demonstrates the cross-institutional linkages we're looking to create towards educational attainment. So basically what Better Care Teams is It's standardized on-the-job training for members of the care team within the medical home network, specifically the unlicensed members. So again, the community health workers, the care coordinators, the patient navigators. They get 13 disease-specific and behavioral health courses in addition to motivational interviewing, and then we have a competency through simulation at the end, which includes both a formative, a summative, and then they get internally certified by the medical home network as care coordinators. The reason I included this is because, inspired by the success of Medical Home Network's partnership with Rush, and then Malcolm X's partnership with Rush, and then seeing the value of the formalized education around community health work, so the CHW Basic Certificate at Malcolm X, MHN separately donated $20,000 in scholarships to the Malcolm X CHW students. So they did that to further MHN's missions of enabling success community-based care teams. You know, the MHN board approved these scholarships for those coming from the community to get their education and return to the areas that they serve. So we really just want to highlight the value of these new connections fostered under BHUC and how unique and deep this multi-layered partnership has really become. So this is just an overview of some of the ways we track the metrics between Rush and Malcolm X. So this is the scorecard tool that we use. It was developed under BHUC to keep track of metrics and monitor progress of the various programs under the Better Training area. You know, we wanted this work to be approached in a way where we could measure the results and demonstrate the impact that we were making. So with the scorecard, we tracked a number of metrics on an annual basis following the academic year. So metrics related to the BSHS program, imaging, vascular ultrasound, faculty development, financial assistance, how many dollars in scholarships are we getting, professional development, scholarship, and even some rudimentary hiring data. So here we just highlight some of the trends we have seen over the years as captured by that scorecard. So that first chart shows what percentage of Malcolm X students are of the total number of bachelor students. So prior to academic 15-16, Rush actually had bachelor's programs in med lab sciences, respiratory, and perfusion technology. But again, like I said, you know, they really have been moving towards graduate level education. So those programs were actually closed after AY 15-16. So that might explain that slight fluctuation in the percentages. The second chart shows the percentage of Malcolm X students specifically for the BSHS program. So if you look at this chart without any explanation, you will see what seems to be a downward trend of Malcolm X students coming into the program. The reason for this is the first cohort of students to matriculate, 6 of the 7 came to us from Malcolm X. But as the program has grown, you know, started to get visibility, it's not that our share of Malcolm X students has gone down, but our matriculation of students from other schools and just the overall size of our cohorts has increased. So just briefly, what have we moved away from? So we highlighted what's worked. I just want to briefly highlight what we've moved away from. So one of the first things we moved away from under the grant is we used to run like these faculty brown bag lunch series at Malcolm X. We discontinued these because of participation. For whatever reason, we just couldn't get the participation level to where, you know, it was something that we should continue with. So we decided to stop doing those. Like I said, with the community health worker program, you know, the associates, the advanced certificate programs were removed from Malcolm X's active course offerings. Again, you know, we have those academic programs at Rush that were closed. Now, those weren't directly related to BHUC, but of course, as we remove bachelor's level programs, you know, you remove the pathway from students who are coming from Malcolm X with an associates into Rush. So we say that that does have an impact on the work that we're doing. And then finally, for our Health Disparities Fellowship, so the first cohort included students that were prepared at the master's and the doctoral level. As we look towards the second cohort, we felt it would be best to only move toward doctorally prepared students. So here we just highlight some of the lessons learned from the past 5 years. You know, relationships, they take time to build trust. You know, we spent a lot of time listening to what each partner wanted to accomplish. Also, with evaluation, you have to protect staff time to ensure evaluation. There needs to be flexibility. Changes in leadership and strategic direction required us to adjust. We can't control everything. Programs, they take time to develop and incubate. Tactical responses to program challenges. When challenges arise, we tried our best to be strategic with our solutions. And then finally, as we look towards future directions, so BHUC has proven the model of success for Rush's institution-wide community health equity investment. So BHUC's funding of research evaluation and the think and do practice has created change faster than typical academic nonprofit program development, because the incubation really allows for the reshaping and improving as we grow and learn. So this vision actually became the catalyst for Rush to approach a more coordinated, multi-program, cross-institutional health equity work for these precisely identified populations. Now that we understand the drivers of health disparities and work on solutions through BHUC, this has further inspired Rush to make a more targeted, strategic, and explicit pledge to addressing these issues in our community. And to this end, Rush is now actually committed to becoming an economic anchor for Chicago's West Side, and is working collaboratively with healthcare institutions, residents, educators, nonprofits, businesses to make our neighborhoods stronger, healthier, and more vibrant places to live. And actually, one of my colleagues this afternoon is going to provide a more in-depth overview of Rush's anchor strategy and the West Side United initiative in one of our afternoon sessions. So I thank you for your time, and I'll take any questions that you may have.
Any questions? I actually have a question for both sets of speakers. Sure. We talked a lot about the immediate preparation and the interview process that you're looking for, how you're setting up for opportunities that you did some great innovative work with shifting, identifying more of how to get people into the system and get them interested. So my question for both of you actually is, have you considered working with, or do you even have HOSA chapters in your local high schools, which are often tied to a health and medical occupations program at the high school? I know that we've just this year, baby step, started a relationship through our MRC with our HOSA chapter at one of the schools, and if it goes well, we'll do it with the other ones. And our volunteer coordinator seems to be happy with that. And then just hearing both of you, I'm like, well, then I missed the boat, because I should also connect them then to our program at SIUE to try to help funnel the students that way as well. I had the HOSA person come in and talk twice in class, but you two have inspired me to say, I missed that connection, I need to make it. So have either of you worked with HOSA chapters? Do you have them? Is that something that you're interested in? Because that kind of continues that pipeline.
Say what that is, something chapter that
HOSA, H-O-S-A, so it's Health Occupation Student Association, I think is what it stands for. So high schools can have a health and medical occupations program. Like the ones at our high schools are usually a 3-year program, and you don't have to do all 3 years if you don't want to. But if you do all 3 years, then the third year you can do shadowing in different health agencies across the bi-state area where we are. We recently connected with them through MRC, but I didn't even think about connecting them to SIUE directly to those health programs there. That would be a great connection. So I was just curious.
Yeah, absolutely. No, that's a great question. So my work really focuses on the post-secondary level and beyond. But if we're looking at Rush's educational strategy overall, we really are looking to expand all of those pathways, from elementary to middle to high school to junior college to bachelor's and beyond. With that being said, on the west side of Chicago, we also have Richard T. Crane Medical Prep High School. So it's a medical health science focused high school. And so within Rush, we have, especially housed within our Office of Community Engagement, we have a number of high school initiatives that are bringing students to campus, offering them a lot of the same work that we're doing at the college level. So they come, they have internships where they get paid, they have formalized curriculum, and it's our hope to really sort of capitalize on those relationships between Rush, Richard Crane, Malcolm X, other academic institutions within the medical center in Illinois Medical District, to really sort of create that solidified pipeline of talent to the health sciences.
So follow-up to the idea was to get them out into the employment workforce. And of course, having to sit here in public health, they're not going to be partners. Yeah. So I guess you're going to pull them in. But what's been the employment rate post-completion?
Very good question. So we've just started to look at some rudimentary employment data in terms of number of students finishing at Rush, number of Rush employees going to Malcolm X for employment data. And we saw that the numbers were good, but they weren't great. So as we look towards that sort of West Side United, one of our focus areas is preferential hiring and moving students not only through that academic pipeline, but coupling that with career ladder development and really building out that sort of robust workforce development initiative. So again, building healthy urban communities really sort of laid a lot of the groundwork for initiatives that we're starting to see launch right now, and workforce development, preferential hiring is a part of that.
I just wanted to add to this point about HOSA, more so I guess a recommendation is that in addition to partnering with HOSA, within different schools you can partner with AHEC, which there are do you all already work with AHECs? No. Okay, so AHEC is Area Health Education Center, and it's part of a federal program, so there are AHECs all over the state of Illinois. So that's an option, because I know AHECs also oftentimes work with HOSA in different high schools. And AHEC is, at least Chicago AHEC specifically, is engaged in this what kind of longitudinal career trajectory, right? So it's not just focused in high school, but we can work with communities, college students, and academics, and beyond throughout their careers.
Absolutely wonderful.
Other questions for either of the speakers?
One more about, I know you said that you had a specific partnership with Malcolm X.
Sure.
But when you talked about the non-Malcolm X, did you do any analysis who came out of the other city colleges?
Actually, we have. So, and I don't know if I mentioned this, but this first grant is a 5-year grant. So we're in the 5th year of our grant. So right now we're sort of looking at where do we want to go next. So we saw, as our numbers with Malcolm X, looking at trends over the years with the BSHS program, we also saw an increase in the number of students coming to us from just regular other city colleges of Chicago. So they may not be coming to us from Malcolm X, they may be coming from Harold Washington or Kennedy King or any number of the other city colleges. We also see a number of students coming to us from, our inner ring suburban community colleges as well. So one of the areas of focus for us moving forward is using the lessons learned from working specifically with Malcolm X to expand that more broadly with city colleges at large. So that way we're really sort of capturing all of those students who may have an interest in the health sciences. Even if they aren't coming to us from Malcolm X, they're still getting that specialized attention.
Other questions?
Are the students that are going through the program, are they showing interest in sort of giving back to the communities where they came from? Are they really wanting to be getting jobs or being placed in locations where they're working from their roots? Or are they more interested in sort of going out and expanding and going to different places, or a little bit of both? Or how has that been?
It's a little bit of both, but I will say the students that are most vocal about where they want to go are the students that are just dead set on going back to the communities where they came from and serving them. It's really wonderful. So.
Amy?
A question for you. In our local area, you give me a lot of inspiration and things to think about. In our local area, our medical school is really changing their curriculum and having it be more community-based, looking at all of the social determinants of health and how medical care interrelates with that. So how much is your medical school faculty feeding into the types of skills that people are working on?
Amy, could you share the medical school?
For us?
Yeah.
University of Illinois College of Medicine in Peoria.
Okay, wonderful. So at this point, a lot of our initiatives have really been focused in the College of Health Sciences. And the reason for that is, again, because you have those direct pathways from 2-year institutions into the BS program. So we really wanted to sort of use these other initiatives to really sort of expand that pathway. So at this current point, we haven't really seen a lot of influence from the medical college. But moving forward, as we align what we're doing with Rush's overall strategic plan for diversity and inclusion, we really want to do better to engage both College of Nursing, College of Medicine, and the Graduate College on some of the work that we're doing and demonstrate those pathways, not only to careers in the allied health professions, but to medicine, to nursing, to PhDs as well. So.
Our College of Medicine is similar in that we have many different disciplines within that one college. So it would just be an interesting connection with our work, our community health assessment that you talked about, and then how the curriculum is changing in the medical school, and then what our hospitals are expecting their change to be because of their community health needs assessment. Would be kind of an interesting conversation.
Yeah, absolutely.
Thank you. Thank you. You're doing a great job. Both of our speakers